Hello everyone, my name is Mira. Today I'll be talking about branchiomycosis, which is commonly known as gill rot disease. So you must be wondering what is branchiomycosis, right? So branchiomycosis is a fungal disease that primarily affects the gills of the fish, causing severe gill tissue damage. It leads to gill necrosis, impeding the respiration and often resulting in high fish mortality. The disease is commonly triggered by poor water quality and overcrowding in aquaculture settings. So, if you are dealing with a large number of fish, and especially when you are in the industry, you might want to know how to avoid this disease. To combat this disease, we need to know the agent. So, the causative agent are typically fungi from the genera Branchiomyces, particularly Branchiomyces sanguinis and Branchiomyces demigrans. These fungi it thrive in warm, stagnant, and poorly oxygenated water, which is why branchiomyces outbreak often occur in aquaculture system or natural body of water with suboptimal condition. Moving on to the host, branchiomycosis primarily affect freshwater fish such as the tilapia, the salmon, catfish, which is ikan keli, the eels, which is ikan belut, ikan carp, and also guppies. So where do we can find this disease? So branchiomycosis has been reported in Europe, Asia, Middle East, Australia, and also North America. And it is also globally distributed in region where there is summer water temperature which is above 20 degrees Celsius, which include Malaysia. So, what is the mode of transmission of this disease? It is actually from water. So, firstly, the fungal spore from water will be transmitted to the gills, and then this spore will adhere to the gills, germinate, and produce hyphae. And then the hyphae will penetrate the gill's epithelium or within the blood vessel of the gills. And then after incubation period, the fish will start to show clinical signs. The most common clinical sign that can be observed is the gill rot lesion itself. So the gills may appear necrotic, eroded, pale, and blotchy due to tissue death. And then there will be a respiratory sign, which manifests as a rapid gill movement or gasping at the water surface. And the fish will also appear lethargic. And if the disease is severe enough, we can see a skin changes, which is a patches of gray on the skin. How to treat this disease? Unfortunately, there is no cure for branchiomycosis. However, we can prevent it from managing the water quality, especially the temperature, dissolved oxygen, and also the nitrogenous waste. To control this disease, if there is any outbreak, the dead fish must be removed from the pond or aquarium and disposed of, and then the surviving fish, which are the carrier of the infection, should be quarantined. And then the pond or the aquarium should be dried and treated with calcium oxide as a way of disinfection. And then, how to diagnose this disease? Firstly, we can perform direct microscopic technique, which we can observe the non-septate branching of the oomycete with spores. Additionally, we can just observe the gill rot lesion itself. So the gills may appear necrotic, eroded, and pale and blotchy due to the tissue death. Lastly, as for the predisposing factor, it is water quality, which has low oxygen level, high organic waste, and stagnant water, and also the water that has high ammonia level. Water that has a pH of 5.8 until 6.5, and also with temperature 20 degree Celsius and above will promote the fungal growth. And if the aquarium also has overcrowding condition and also there is a presence of dead fish, this will also be a predisposing factor for this disease. That is all. Thank you.